Hello. Yes, that's me. How are you doing? And what can I do for you today? Wow, wonderful, wonderful, wonderful. Well, I'm not doing too bad. Thank you very much for asking that. So, tell me, what can I do exactly today for you? Interesting. So if I get it correctly, you have trouble with your eye. Redness. Pain as well. Alright. Yeah, no, definitely. You can definitely come by. Drop by whenever you want. Yeah, today's possible. Of course. Alright. Great. Oh, well, I'll see you pop up in the clinic, I suppose. Alright. Okay. Yes. Alright. Yeah. Okay. Yeah. We'll do. Alright. See you in a bit. Bye. Alright. Well, that's a new patient. That's coming in today. Hello, reception? Yeah, hello. Please, make sure that, oh, I already called the front reception as well. We'll make sure they are guided to the right wing of the clinic. Thank you very much. Alright, thank you very much. Yeah. Okay, bye. Alright. Let's do some eye examination, shall we? Better get my stuff ready. Interesting. Straight as a razor. Oh, come in. Hi, welcome. I'm Dr. Rocky, and you must have called your patient. Yeah. Welcome. I'm glad you're here. I'm glad you made it. How you doing today? We talked briefly on the phone, of course, but now I see you in person, and now I know who you are in terms of face. So tell me, how you doing? Well, that's good to hear that you're doing fine in general, except with the eye, which is visible for me as well. That's not going well, or not all too well. Jeez, what have you done with that? Alright, that looks quite thick. Holy shit. Must hurt. Alright, well, I'm glad to hear that you're doing in general fine. You must be new to town, I assume? I thought so, because I don't know you. You are new in the clinic, and for the last 5 years we didn't register anyone new, so that's quite a change, I tell you. You know, you see, we're quite a, community where everybody knows each other, you know, the neighbors know the neighbor, and we don't lock our doors here, because it's all quite safe. And when a stranger like you comes, that's always quite interesting to say, at least, but nonetheless, welcome to Springville. So, after you've registered, I guess we're all ready to go. So, today we're going to examine the eye, but I always like to do some little pre-tests, as I call them. I like to listen to some vital organs like the heart and the lungs, of course, before we even start. Now, what I want you to do is I want you just to stay calm and stay relaxed. Now, if I may, I'm going to raise your t-shirt. Now, I do warn you, this might feel a little bit cold. Now, I'm just gonna put the stethoscope on your chest. There we go. Oh, it's a bit cold, I told you. I wasn't lying. Alright, we're gonna count to 10, okay? So count with me if you would. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, and 10 Mississippi. Alright, sounds okay to me. Now I will write down those results on a paper normally, but these days we do everything online, which is a new thing, and everything is done through the phone, and folks back home can log in onto the online web portal and see all the results. How about that for someone that's called, eh? Bet you didn't see that one coming here in Springville, Mississippi. Yeah, lovely place this is. Alright, so now we have done your heart, we'll move down to the lungs. Now, I want you to stay relaxed, okay? Just get comfy. Just get comfortable, okay? Just breathe in easily and breathe out. Do make sure to breathe, because I don't want any dead patients here. That's a joke, yeah. Now, just sit nicely. Dead straight. Back straight. Very good. Good posture. Now, breathe in deeply. And breathe out like that, okay? Just do that a few times. Just get nice and comfy, will you? You comfy? Good, good. Alright, now I'm gonna put the stethoscope again on your chest. Now this might feel a bit cold. Yeah, I called it, yeah. Alright, so now I just want you to breathe in again like we did. Alright, good. Deep in. In. And deep out. Might get again. Deep in. Hold it. And out. Okay, good. One more time. Deep in. And deep out. Very good, very good. Now one more time. Deep in. And deep out. Alright, mighty fine, well done. Now I'm just gonna put this on the back of your back. Alright, now I can do it again. Deep in and deep out. Yeah, very well. This side. Deep in and deep out. Yeah, good. Well done, mate. That's good. Well, there's nothing odd to hear. Now, what I will do right now is we'll get to the first thing, most important thing. We're going to do a little visual checkup of your eyes with my little otoscope. Now, of course, for your hygiene and my hygiene, I will put on some gloves. Alrighty. fan gloves, I tell ya. Made in the South, raised in the South. That doesn't make sense, I know. Because gloves don't get raised in the South. Only get made in the South. I'm just joking. I'm just joking with you because most of the guys, girls, people who come here take the piss out of us, calling us hillbillies. And just acting to be fake-headed for you know. Just making some puns, you know. Don't you worry about it. No, I'm just joking. Anyway, what we're going to do right now is just a visual examination of the eye, okay? Especially that eye. Because I don't see anything visually wrong with the other one, but we're going to take a look. I'm just going to take a look what I see. Do I see anything that concerns me regarding redness, thickness, maybe anything else, alright? Now, what I'm going to do first, I'm just going to visually check it myself with the naked eye. I'm just going to slightly touch you. Okay. Well, it does seem quite thick, doesn't it? It feels quite tender, quite stiff as well in a way, actually. It's a bit odd because you can see down here there's a thickening. Yeah, you can clearly feel it, like it's swollen. The same with the upper eyelid, it's swollen. Now, what this usually indicates that there's moisture. Now, that moisture might be because of numerous reasons, infection, or anything else. Now, another thing this could be is an allergy. Do you happen to have any allergies? Besides hay fever, of course. Oh, okay. Alright, well, that should be no problem then. But then, well, it's nothing to do with that kind of allergy, at least. Now, it feels quite swollen. It looks swollen, definitely is swollen. It doesn't wobble, like there's no moisture inside, at least. It looks like a blister. Now, when I press it, does it hurt a bit? Like that. It does not hurt. And up here. No pain, or some pain, or no pain. No pain. Well, that's a good sign. Well, it's a good sign because there's no pain. Don't worry, I'm just joking. No. So, first things, it looks just very infected. It's very hard. Swollen. It looks like there's lots of moisture in there. I'm going to try to open it a little bit. So I'm just going to check if I can see anything inside of it. Maybe if there's pus, then it might be an indication of, indeed, what I already said, an infection. And if that may be the case, then we'll just have to treat it with some antibiotics. So, but let's just first see. So is this too bright for you? It's not too bright. Alright, good. Just gonna come close. Alrighty. Now, taking a look at your eye, raising your eyelid a little bit. Alright, well, I can definitely see loads of redness. It's definitely irritated. I can see that by the fact that your eye white, like if you look at my eyes, it should normally be white. Of course, you'll see some veins, but yours is just full on red. That's the first thing I noticed when you came in. It just looks infected as hell, or irritated at least. Yeah. Alright, now I would want you to look up for me. Yeah. Look to the right, and to the left, and down. Yeah, that's infected. That's some pus in there. Alright, come here. That's definitely infected. No, no problem, don't worry. It happens a lot, actually. Yeah, it's just a bit, in fact, just here, when I press this, you know, when normally your tear duct is, and in the morning you wake up, you got morning soup. While yours, instead of tears, it produces pus. This is clearly a sign of infection, and you can see it all across your eyelid down there. It's not good. Not anything bad in terms of, oh, we're gonna die. No, you're not. Might lose an eye. Joke. No, but it's just infected, which is not good. We have to treat that, definitely. The quicker the better. Yeah, okay. Looks fine with that. Yeah. Now the other eye. I'm just gonna take a look at that one. It doesn't seem to have anything wrong with it. Doesn't look infected at all. Which is quite extraordinary, because normally both eyes would be infected. They would both have some sort of infection. This one seems nice and clean, and nice and healthy, nice and white. White. Good. Not red, but white. Contrary to the other one. As we know, a white eye is a good eye, because otherwise it would will give a sign of infection, irritation, or anything else. But that looks fine. I don't see anything wrong with that one. So, in terms of the other eye, what kind of other complaints do you got with that one? Yeah, as I expected. Yeah, that's normal. Anything else? No. So no other complaints besides what you already stated that you. Yeah. So it hurts. That's one. Blurry vision. Well, I can tell you the blurry vision is because of the pus. Now, the pus is a substance which is thick. It's a thick, yellowy, white substance, depending on what. Now, this gets thinned out when you blink, and then you have a chance sometimes that it gets all over your eye. And when it goes up, indeed, when it covers your eye in the middle, then it will be covered. It will be covered by a layer of pus, like a film layer. Yeah? No, when that happens, that's why you see blurry, or like a blurrish, foggy vision, which is normal, because if you blink a few times, it's gone, or you do it like that, it's gone. So that's not a worry at all. So don't you worry too much about that. It's totally not necessary at all to worry. It should just be gone after a few days after we treat it, of course, with antibiotics. That's a reception. Your registration has been successful. Yeah, your insurance has covered it. Well, that's great, isn't it? That's a great day. That's a far off now. Anyway, back to the point. Should be fine. Should be gone when we treat it. Now, let me just take a further look into the infected eye. Yeah. It's infected. It's just an infected eye. Nothing else to worry about. I mean, your vision is furthermore fine, right? No complaints about that your vision has been or getting worse or anything like that. No. That's all a good sign. Yeah, it is. Alright, now I will treat it with some antibiotic. I am gonna take a little sample. Oh, don't worry, I'll get another one. I will take a little sample of the pus. Yeah, I will send that to the lab, and then hopefully tomorrow we'll get a result back. If there's anything else besides that, indicating that there's something else than just an infection, because we want to know for sure, of course. So I'm just gonna take a sample. So I'm just gonna pull the eyelid down. Sorry if it hurts. It's not a COVID test, so I guess that's something. Just gonna put that in the back. There we go. Now I'm gonna send that down to the lab, and that'll be taken care of. Now I'm gonna check your pupils if they just work fine. So just look straight at me. Very good. Now close your eyes. Now if I say yes, I want you to open them, okay? Or at least open one. Whichever. So 3, 2, 1. Okay, very well. So there's a good reflection to it. There's a good direct and indirect reflection, or reaction reflection. So that's good. So indeed, when you open your eyes, it does get bigger straight away, your pupil, which is good. Now it indicates that they work fine, at least that one. Now we're going to do the other one as well. So again, close your eyes. Alright, we're going to count again to 3, 1, 2, and 3. Alright, fine. No worries about that either. Pupils respond fine, which is a good sign. So that's fine. And normally we'll do an eye test, but it's not needed in this case because clearly you don't have any complaints, problems with your vision besides blurry vision because of the pus getting all over your eyes, over your pupil, etc. So there's no problem with that, which is good. Now we've handled that. Now that's all done. My recommendation for the coming week is very simple. After this, go to the pharmacy downstairs. Just go to the reception and ask Albert to give you your antibiotics. I will. We don't work with like little papers, like prescriptions. We don't do that here, so it's all fine. It's the town's pharmacy. He knows. So just go down, go to Albert, ask him for antibiotics for the eye, and you will get a little tube with drops. Now every day before you go to bed, every day when you get up, and around dinner time, just put a drop in, okay? And then after a week you'll be fine. Now keep your eyes clean. Don't touch it with dirty hands. Don't get it dirty at all. Just stay clean for the coming day. Shower. That means shower. Yeah, but that's all. Now if after a week it doesn't go away, now call me again and make an appointment. Well, you don't really have to make an appointment. Just walk in and then we'll look at it. Now I will send the pus to a lab so we can get some data from that. Now, to my expectations, there should be nothing, and I say nothing, wrong with it. But I cannot know for sure. I cannot know for 100% sure. Okay? So we'll have to see how that one goes. But I expect there will be nothing really wrong with that. But we'll have to see, I suppose. Yeah? Good. Now, from you to me, are there any questions? No? Alright. Good. Alright. Well. was good to meet you, and I wish you a great day. The exit is behind you. Like I said, go to Albert, and he should help you further. Yeah? Alright. Have a great day. Bye-bye. Bye-bye. Bye.